Hello, Professor Jones. It's Pauline. In this video, I will be demonstrating an IM injection. The first thing I would do is check my doctor's order to make sure I know what I'm giving, and I would check my vial to see to make sure it's not expired. I would then draw up into the vial, into the syringe, the amount that I'm supposed to, and then I have my cap on it there, and then I would go see my patient to administer an injection. I perform hand hygiene, provide privacy. I would introduce myself to the patient. I would let the patient know what I'm doing and the reason for the injection. I would ask them if they have any allergies. I'd also identify them by two patient identifiers, name and date of birth, looking at the ID band. And once everything is okay, I would proceed with the injection. I'd be giving it in basically the gluteal area back here, the dorsal, closer to the trochanter. So that's the area I'm choosing to give the injection in. So I'd inspect the area, make sure there's no bruising, no skin integrity, make sure there's no edema, and so I make sure this is a good area to choose. I would then apply my gloves. Okay, I will take my alcohol pad. I will clean the area, going inward, outwards in a slow motion. As that's drying, I would get my dry gauze I will use for pressure after the insertion. Remove my cap. I form like a V formation on the hip, and in this little area here, which I can use as a guide to make sure there's the area I'm going to be in, I can put like a alcohol pad there just to make sure I'll be inside that area. So I would take my syringe at a 90-degree angle, pull the skin, and go straight down like a dart. And then with my non-dominant hand, I would hold it in place, aspirate just to make sure there's no blood in there. Okay, there's no blood, so I'm in the right place. Go back there and pull the skin. Insert my medication. Slowly pull out the needle. I would apply the pressure there. Put on my safety cap. And if there wasn't any bleeding, I would go to another site and I'd place a bandage on this one and do it all over again and get a new syringe. Okay. Then once I've done all that, I make the patient comfortable. I'll let them know if they have any questions or they have any side effects, so please notify me. So I put the call light within reach. I would go back to my area, document the procedure, make sure I put the site where I gave it at, and that's how I would give an IM injection. Thank you.